So you have always heard your medical officer saying that this ECG has RBBB. What the fuck is that? RBBB stands for right bundle branch block. It's a kind of infranodal block, the blockage of the pathway that occurs after the AV node. So in the patient with RBBB, septal depolarization occurs normally, which is from left to right, which causes a positive deflection in V1 and a negative deflection in V6. The electrical pathway then travels to the left ventricle first because the right side is blocked. So it will cause a negative deflection in V1 and a positive in V6. When I say V6, I mean all the lateral LEDs, which is LED 1, AVL, and then V5 and 6. So lastly, only the electrical pathway can go to the right ventricle. This can cause a positive deflection in V1 and then also a slur S wave in V6 lah. Senang only ma. So in V1 we can see a M wave pattern, and then in V6 we can see a W pattern. So this is how the marrow comes. Senang je kan? So to diagnose RBBB, you need to have a prolonged QRS. Why prolonged? Because there is an infranodal block. QRS stands for ventricular depolarization. When there's a block, the ventricular depolarization will be prolonged. The RSR pattern, which is the M wave in V1, and then also the slurred S wave in the lateral LED, due to the left to right depolarization that occurs at the end of this QRS thing. Thank you, and that is the end of the video, and subscribe if you haven't already.